Welcome back. This is the second video in of the third year. I realized through doing all of these videos and making all of this content that I never discussed the therapeutic process or how to go about getting help, how to find a therapist. I think those things are very important and I just kind of do them almost on a daily basis. So it's weird to me that I haven't done a video, but we're going to go ahead and start off. So, a lot of people don't want to get therapy because, there's, of course, a stigma attached to the idea of going to a therapist and getting mental health. And as much as people just kind of praise it as a good thing now, there are still people out there that are just kind of reluctant to go and find a therapist. And I think some of that is the imagery of therapists and therapy. Like it's gone is the day where you have like those kind of Freudian people sitting across the room from you, excuse me, with these glasses on that's looking over them and tell me how you feel. It's some of that, but it's not as robotic and it's not as impersonal as it seems on television at times. Um, just go and look at TikTok and you'll see there's some very progressive therapists there. Um, and so that's what it is too. It's like finding the right kind of therapist, the therapist that will just kind of fit you. And you really want balance. What you don't want is someone that you're too friendly with and it feels like you're going in and you're just kind of gossiping about your day, giving your therapist all the tea, but like not doing any work, not processing. And you also don't want to, at least some people, bombarded with homework and worksheets and you're barely processing and all you're doing is that technical piece. And let me be honest, that technical piece works for some people, but what I've found is if you don't do that processing that you need to do, those issues will come back up. You'll see them again, and we'll just kind of discuss that in one of the videos. I think I'll definitely make that a video. So they have this wonderful thing called consultations. So you can do consultations with a therapist to see if that person will fit you, if it'll just work for you. Consultations typically take about 15 minutes. Interview the therapist, right? Ask them, what treatment modalities do you use? And treatment modalities is just what kind of process do you go through to just kind of you take your clients through, right? So one example of a treatment modality is cognitive behavioral therapy. That's basically a therapy where you're just understanding that your mind affects your feelings and your behaviors, and that the seat of your mental wellness is directly reflected in your thoughts. You also have motivational interviewing. That's definitely it's focused on helping the client realize that they can change and how to go about changing. There's also steps to help the client understand that change isn't as linear as we think it is. A lot of people think once you make a change, boom, it's done. And that's not how it works. I think I talked about it in the previous videos. Change is more circular, it's cyclic. Um, and so I think understanding that is really, really helpful. Um, to just go back again to what I said initially, and hopefully I'm not repeating myself. It's definitely the age, but it shouldn't feel too friendly. You should definitely be making process. And so how that would fail you is if in motivational interviewing, you and your therapist are just talking in circles, and they have yet to figure out how they can make a change or come up with a thing that they're struggling with, or just kind of making any connections. And so again, when you're interviewing a therapist, you want to talk about those treatment modalities. You want to talk about like, how do you give a lot of homework? Do you not give homework? Are you comfortable with confrontation? Because that's important. If you have a therapist that's just really, really nice and doesn't want to hurt your feelings, 9 times out of 10, that person isn't going to work for you because they're not going to be, for lack of a better word, I'm going to say brave enough to tell you that, okay, yeah, I don't think you should be doing that. I don't think that's healthy for you. And not that your therapist is full of, don't do that. But they should be able to say to you, I don't know if that's healthy behavior. And let's look at that. Where is that coming from? Let's explore that. So that's the part that goes back to that whole Freudian thing we were talking about. Um, but you definitely want to again go through that process. And so a lot of times when you do that initial session, let's say you've just kind of gone through the interview and you've decided that you wanted to be with this therapist, depending on your symptoms, because I have people who have really had some difficult symptoms, and they've had, struggling with PTSD symptoms. They're re-experiencing, they can't sleep, they're in anxious wrecks, they're having panic attacks. You cannot have therapy once monthly if your symptoms are that acute. That is a once weekly type thing, and then your therapist will slowly wean you off to biweekly or weekly. But don't think if your symptoms are that acute that you can go in and you can start monthly. A caveat to that also, and I want to preface this by saying I'm not one of those therapists that think someone should always take medication. I'm not that person. However, there are some persistent mental health conditions that you do have to take medication with, and your outcome for treatment, like successful treatment, depends upon you taking your medicine on a regular basis and participating in therapy or therapeutic programs that will help you. So that's really important. And so I'm going to do another caveat on top of that one is a lot of people don't understand like the tiers of therapy also. Well, I don't want to say therapy, but mental health. So a psychiatrist is a person you go to for medication management. They really don't do a lot of talking outside of that initial session, right? Because in that initial session, they have to get all your symptoms. They need to see how your life is set up, and they have to get some history, right? So that's in order for them to assess the situation and say, hey, symptomatically you're diagnosed, I'm going to give you this diagnosis because everything you set up lines up to this. After that, they're going to check in, see how the medication is affecting you, to see how your symptoms have shifted or not shifted, whatever the case may be. And and that for some people is every 30 days, every 3 months. I would question mark some that want to see you for 6 months and a year. It's not, yeah, I would question mark those that want to see you 6 months to a year. That's kind of far out. Anything could happen. And then sometimes your medication, there's all sorts of complications. You can have no symptoms in the beginning of taking a medication, and then all of a sudden start experiencing those side effects. So the other part is psychologists, right? So psychologists are twofold. One, they're test and measurement. So if you're going someplace and you're taking a psychological exam, that would be a psychologist that's doing it. And they would be able to tell you through test and measurement what diagnoses you have. I suggest psychologists a lot because what I found in this field, I've been doing this for a very long time, and I found that you can have someone that is, a doctor has told you, like your PCP has said, I think you're suffering with depression. You go to a psychiatrist and they say, oh, I think you have bipolar disorder. Then you go to a therapist and they can say, oh, well, I think you have borderline personality disorder. It's all over the map. And honestly, it depends on the symptoms you communicate. The therapist, their level of education and knowledge, and like all of that factors into what your diagnosis is. And sometimes confirmation bias, like if I'm seeing a lot of patients with bipolar disorder that month, and you come in and you're similar, it's like, you have bipolar disorder too, blah blah blah. But anyway, you can, again, just kind of confirm something and not really have enough evidence for it, which is why I love testing, because with testing, you will go and see a PhD level psychologist. So there you'll go through a battery of testing. You usually have to go back 2 or 3 times. And this will help you just kind of really run down your diagnoses to ensure, okay, this is what the client actually has. This is what they need to be treated for, and this is what they should go to therapy for. And when I say treated for, I mean in regards to medication. There are so many disorders that are very, very similar that test and measurement really helps to just kind of flesh it out. Especially when you're talking about pervasive disorders, which autism, social communication pragmatic disorders, and there are other pervasive disorders that are just really nuanced and they're hard to figure out. And psychologists and test and measurement are the best route to go. The other side of the PhD is the specialized treatment provider, meaning personality disorders, eating disorders, and just a higher level of higher education level. And some people are more comfortable with that. Like I've had clients say, well, are you a PhD? And I say no, and they say thank you. And I'm okay with that. Because, I want I want a client to be in my office if they're 100% comfortable going forward. I don't want the question mark in the back of your head of, you're not a PhD. I don't feel comfortable with you. Yeah, no. So the last part of is actually going to see a therapist. So therapist is a master's level degree provider. They still have a lot of knowledge. They still have to go through a lot of training. And, just depending upon the therapist and finding the right fit, you're very much so under good care. Again, depending upon the therapist. So choose wisely. One of the things I think is important is that when you go to therapy, I think understanding the therapeutic process would be helpful. And one of the things to understanding the therapeutic process, I've had 2 kind of experiences with clients that have left me just going, Like I remember a client a long time ago, she wasn't coming to therapy, and I really just thought, this person, you need therapy to just kind of help you with everything you're going through. And at this time I was really young, and I was doing community counseling, meaning I was going to people's houses and talking to them and their kids. And I remember her telling me, well, I got a lot going on and I don't have time for therapy. And, being young, I was like, well, therapy will help you with that. It'll just do these wonderful things for you. But what I didn't realize as a young therapist is that she just wasn't ready, right? She just wasn't ready to talk about therapy. And regardless of whether she had a lot going on or not, if a person is not ready to go to therapy, then it won't be something that works for them. And you have to set in your mind that therapy is something you want to do, because it's going to be very uncomfortable, especially for those who have experienced trauma. And I don't mean uncomfortable in the sense of, let me out, I hate it here, but uncomfortable in the sense is that you have to talk about things that are just difficult, that weren't fun, that weren't good, and, things that you were possibly damaged by. So that's a really hard thing. So yeah. Yeah, so the other part of the second kind of client I've had come in that will just kind of really, for lack of a better word, just kind of scream, I'm not ready for therapy, is the client that comes in and doesn't tell the truth. And I've had people just kind of ask in the past, like, why would a client come to therapy and lie? I don't have an answer for that other than they are just not ready to dig into those things that can be hurtful, that could be jarring, especially when it comes to trauma. Like re-experiencing is most definitely a thing the kind of compartmentalization you have to do to just you're going into repressed memories, and for some people, and that's really difficult. And so I don't want to go down that rabbit hole, but I just wanted to explain a little bit about why somebody would come into therapy and lie. I also feel like in those two situations, you may not be, or you may not have found the right therapist, because I do feel like if you find the right therapist, then they'll sometimes there's instant rapport for some people, right? Like I see you, oh, you see me, oh, okay, I think we'll mesh well. Like that kind of rapport happens sometimes with therapist and client. Like I remember, I think I mentioned this in a previous video, that me, a little brown girl from the inner city of Chicago, my first therapist was in foster care, and this was, I don't know, I'm assuming a suburban, just kind of buttoned up white man. I remember his shoes. I remember everything this guy had on because I remember thinking, what am I going to talk to him about? And it's what's really, and I remember this because I felt like it was really a changing point in my life, because I remember thinking the entire time, I'm not talking to him. I don't care what he asks me. I'm not saying a word to him. And then the other thing I remember thinking is I could do a way better job than he's doing right now, because he never even tried to engage me. He sat there in silence, which I now know is a therapeutic technique. But at the time, I was like, what are we doing? Why am I here? And when do I get to leave? So I definitely probably wouldn't have bonded with him. And so having a therapist, I mean, and especially since he didn't try to either, because what I do know about the therapeutic silence is after a little while you do have to engage, and that's not what happened in the session that day. One of the things also, when you go to a therapist, if that bond is important. So before I get to that piece, that bond is really important. Building rapport is very important, and you want to feel comfortable and safe with your therapist. However, again, like I mentioned previously, if you are too friendly with your therapist, meaning the bounds have crossed and you go into session one day and, for example, your therapist says, oh, girl, I don't know if I can do therapy with you today. I got into a fight with my husband and I just cannot. And the client says, well, tell me, give me the tea. And you start talking about all sorts of stuff that you have no business talking about when it comes to a therapeutic relationship, because it should feel comfortable and safe for you. But therapy should very much so be person centered, and the person it should be centered on is the client. Always. Always. Now, there are some therapists that do share, and I don't think there's anything wrong with that, right? Like, I'll share stories about my dog. I'll share stories about my past trauma or anxiety, and not in the sense that it's to take over the session, but it's more to help my client understand, like, hey, I've been there, I get it, not in the exact same circumstances, but I understand that this takes work, and that I'm with you on this. Also, just understanding too that whenever you create a rapport with someone, that if the bonds actually feel intrusive, because there are therapists who will take advantage of a power dynamic. I haven't seen that a lot, but it does happen. I just saw the news story that highlighted a therapeutic relationship that was just out of control. A therapist had started to stalk a former patient. And so I'm saying that not because I want to scare you, but I also want you to know, like, if you start to feel uncomfortable with your therapist, if you start to feel like, you're not making your own decisions, or you feel like your therapist is managing you, controlling you, or they're coercing you to do things that you're uncomfortable with, that's a sign that you need to get help and you need to get out of that therapeutic relationship. That's very important because therapy can leave you in a very vulnerable state. And, and it also puts you in a position where you trust someone fairly quickly. Another thing that happens in the therapeutic relationship, and this to me is really important, because a lot of times you do go to therapy and you'll have those days where you just want to talk about those day-to-day things that are going on in your life, like those initial stressors and triggers, and that absolutely makes sense, right? That you want to talk through those things because you feel a little overwhelmed, or you were just kind of so upset by something. It was triggering. And a lot of times when you talk about those triggers, you could go back and explore, like, why did that trigger you? What do you feel like? Where do you feel like that comes from? And so the thing that I feel like, you just kind of have those free conversations. But the thing that I think is important is that you do have goals and objectives in therapy, right? You agree upon those. Like, because when you go to a therapist, you're not going because you just want to, and let me preface that by saying not everyone goes with the idea of growth and development and I want to just kind of explore myself as a human. A good portion of people are going to therapy because they are struggling with something in some way and they want to talk it through. They want to process a feeling. They want to feel better and they want to do better. Because a lot of times when you're talking about the personal growth piece, and I don't want to get too far off, again, not to say that people don't go to therapy for that personal growth, but a lot of times you're going to do the self-help and you're going to do other things that'll just kind of grow you as a human. The second part of that, again, back on topic, is goals and objectives are really important for therapy. You want to have a focus. So if the goal is, I'm struggling with symptoms of PTSD, what does that look like? Well, my anxiety is really high. It's so high that I'm having panic attacks in the morning right before I go to work. Okay, so a goal would be, what do we need to do? So the objective, is to figure out what's triggering that anxiety, right? And the goal could be, without knowing what's triggering the anxiety, because that's a deeper part, right? The objectives are sometimes the deeper processing piece. But the goal could be implementing coping strategies to help manage the symptoms associated with PTSD, meaning let's do some breathing techniques to just kind of help with those ensuing panic attacks. What does that look like? Implementing those coping skills. What can you do? What time of day are they happening? So you want to have a focus for the therapy because processing is really difficult, and it's especially difficult when you don't have a plan, when you're all over the place. There's no goals, there's no objectives, there's no structure. And also, I do want to say this, that although there is a goal and objectives, structure doesn't necessarily mean regimented. There can be a structure because we've talked about those goals and objectives. We know that that's the thing that we're working on. And so it's not that we're checking in saying, hey, are we on target? Goals and objective, blah, blah, blah. But you know that that's the focus, right? The other thing is having tasks and activities. And this doesn't mean going back to school, having a lot of homework, but it does mean because if you say, I'm anxious in the morning, I'm having panic attacks before I go to work, I don't know what to do, I feel like I'm going to quit my job. Well, you need your job. That's your livelihood. So let's figure out what we can do. I know you're not feeling good those 5 days a week. So when you wake up in the morning, 2 days a week, let's try these breathing exercises, right? Let's try this affirmations or soothing. And these are just really, minimal examples, right, of what you can try. And so those are the tasks you're going to try 2 times a week. And then we're going to come back and we're going to talk about how that feels. How did that feel for your body? What was going on with you? Did it work for you? Sometimes I will suggest books to clients. I've read a book, you've read a book, let's read this book together, let's talk about those things that were highlighted? What stuck out to you? Those are, those are really, to me, very good tools in regards to when it comes to tasks and activities your clients can do. One activities you one type of activity you can also do with your client, and it's not necessarily an activity as it is like a strategy, and it's called behavior activation. So with some people who are depressed, they don't want to get out of bed, they don't want to do anything, and behavior activation is a really good tool. And so inside that tool, you'll say, hey, so you one activity a week, right? Whether that's going for a walk, whether that's going out with a friend, whatever that is, one activity a week, come back, tell me how you feel, let's talk about it, let's figure it out. That is the kind of task or activities you would be looking for in regards to that are a part of the therapeutic process. Okay, so for the end of this video, I wanted to just kind of have a discussion about when you should report your therapist. If they are making you feel unsafe, or if they're behaving unethically, that is a good time to just kind of report your therapist. I know earlier in the conversation I mentioned the therapist that was stalking his patient. So I just want to give you some insight, because this is a very delicate relationship, and you should feel as though you can trust the person that you should trust your therapist, right? That you're going to for help. That puts you in a very vulnerable position. So one example of you should definitely report your therapist is if your therapist is physically, verbally, or emotionally abusive, or if they violate your personal or professional boundaries. It's not common knowledge, but most professionals operate under an ethical standard, and so do therapists. We're not allowed to be abusive. We're not allowed to date our clients. We're not allowed to do anything that would put you in harm, because we absolutely understand that this is a very sensitive process, and you definitely want to trust someone. Can you imagine someone going to see a therapist because they were violated by someone else, and then the therapist violates them? That is just, that breaks my heart. It's so devastating. And so abandonment, if your therapist suddenly stops providing services to you. I saw a TikTok video. So obsessed with TikTok. I have no idea why. Too old for TikTok, but I love it. There's a young lady, her therapist had her sign a contract that if she ever threatened suicide again or attempted, that she would sever the relationship. That is abandonment. You don't do that. Like, you and the client, you work through something, you figure something out. You don't abandon your client when they really need you. And there are people who will just kind of repeatedly say that they're suicidal. Well, that you develop a treatment plan for that. You create some objectives and some goals are surrounding that. Another type of abandonment is if they just don't show up at all. Like, they don't suggest another therapist. They don't say, hey, this therapist is taking over my practice, because things do happen, right? This person is taking over my practice. They'll be seeing you for a little while, or they'll be seeing you ongoing if you agree. Or I have some other therapists here that I've created a list for you that I think you would be a good fit. Just, things that make sense if I can no longer help you. Incompetence. If your therapist provides services they are not qualified or trained to provide. So this one to me is very, very important. Like, you will have therapists that are doing trauma work that are not trauma trained. And you have to be very careful with trauma work, especially if the victim has been raped or molested, because there are so many nuances there when it comes to what you say to a person, right? Especially with the idea around something is my fault and the victim taking responsibility for the attack. You have got to be careful what you say, because if you give the person the impression that they're at fault, they'll either accept or reject that. And if they accept that, it's almost like you're just kind of taking them through another phase of trauma, and I just, again, that breaks my heart for a person. So don't do, don't, if you ask a therapist specifically how much trauma experience do you have, how long have you been trained in trauma work, what's your success rate, it's really interviewing them and asking them those questions that are important, because that's it. I mean, it really matters. Dangerous behavior, if your therapist tries to involve you in illegal behavior, or if they provide services that are experimental, harmful, or dangerous, just don't do it. Definitely report them. A conflict of interest, if your therapist fails to disclose a possible conflict of interest, or if they continue to provide services to you despite the conflict of interest. A lot of times when you work in small towns, like Albany and some of the other smaller communities in Georgia, you have to be honest about who you know, because these areas are so smart and everybody knows everybody. So I've had to do that before. Hey, I know this person, however, this is my standard operating, this is how I operate. Nobody will know you're in therapy, I'll never talk about you or whatever. Like, I'm really strict when it comes to confidentiality, because I absolutely know how small the area is. Then also, like, the last one is billing. So a lot of times therapists will bill, or psychiatrists or psychologists will bill through your insurance, right? Sometimes those professionals will have you pay out of pocket for the same session and then bill your insurance company. You're not supposed to do that. And so that means if I charge you $200 for a session, and then your insurance is paying me another $200 for a session, so technically I've made $400 off one session. And unless I'm a specialized provider, $400 is a little bit outrageous. Well, I mean, if I was a therapist to famous people, then that wouldn't be. But, if you're talking about the common person, the everyday person, that's a lot of money, and you should report them. And so the last thing I'm going to give you is the professional license board's number. That number is 404-424-9966. And I want you to have that number, because if you're ever in a situation where you feel like you're not even sure, okay, am I being abused? Am I being taken advantage of? Has this person put me in a dangerous situation? Because sometimes you don't know. Like, you've been so mishandled for a long time, you can't pick that up. You definitely want to talk to someone about it. And if you don't have anybody to talk to about it, report it to the board and let them figure it out, right? My goal here is to make sure you're safe as the consumer, you're safe as the client, because if anybody is putting you in a situation that you feel uncomfortable in regards to therapy, then they need to be reported so that they can either be fired or retrained. So hopefully all that information was helpful, and I will see you in the next video.